Thank you, Erwin, for continuing to join us, and for those that have just joined us. My name is Mac Bain. I'm the Executive Director of FONOM, and on behalf of the Board of FONOM, I thank you for all joining us today. Late last year, the Executive Directors of FONOM, NOMA, and NOSDA had a discussion about the issue of homelessness, mental health, and addictions, and that crisis that's happening in the North. We went to our boards and asked if we could use MPI, commission MPI, to prepare a report on the current conditions in Northern Ontario in regards to homelessness, mental health, and addictions. And MPI and one of their policy analysts, Parsons, what was tasked to work on it. Holly is a part of the Northern Policy Institute, is Northern Ontario's independent think tank. They perform research, collect, and disseminate evidence and identify policy opportunities to support the growth and sustainable Northern Ontario communities. Their operations are located in Thunder Bay, Sault Ste. Marie, and Sudbury. They seek to enhance Northern Ontario's capacity to take the lead position on socio-economic policies that impact Northern Ontario. Holly created the presentation that the three organizations presented to the Multi Minister Delegations, and it is during ROMA, and we've shared that information with our members, and it has ignited some debate locally and across Northern Ontario. So we're pleased today to have Holly here to walk us through the data collection, the process, and her findings. So I'll now, at this time, turn it over to Holly. Thank you.
Thank you, Mac. Thanks for that great introduction, and thanks for inviting me here today. And also thank you, Todd and Ian and Mark. I enjoyed all those presentations this morning. It's been a very interesting, educational morning, so thank you for that. So this is a presentation on a report titled The Solving Homelessness, Addiction, and Mental Health Crisis in Northern Ontario. Sorry, just trying to figure out how I'm going to get my next slide here. There we go. I'll just start with a land acknowledgement. So MPI would like to acknowledge the first people on whose traditional territories we live and work. MPI is grateful for the opportunity to have our offices located on these lands, and thank all the generations of people who have taken care of this land. Each community is home to many diverse First Nation, Inuit, and Métis people. We recognize and appreciate the historic connection that Indigenous people have to these territories. We support their efforts to sustain and grow their nations. We also recognize the contributions that they have made in shaping and strengthening local communities, the province, and Canada. So we have 3 offices, as Mac said, one in Thunder Bay, one in Sudbury, and one in Kirkland Lake. Thunder Bay is on the Robertson Superior Treaty Territory, and the land is the traditional territory of the Anishwaabeg and Fort William First Nation. Sudbury is located on the Robertson-Huron Treaty Territory, and the land is the traditional territory of the Acknowledgement and Anishwaabeg, as well as the Wahnapiti First Nations. Kirkland Lake is located on the Robertson-Huron Treaty Territory, and the land is the traditional territory of the Cree, Ojibwe, and Algonquin people. So Matt gave a bit of an introduction of MPI, but I'll just carry on with that. So we're a think tank that conducts independent research, policy work, to provide evidence-based solutions to sustain and grow the regions of Northern Ontario. So we're independent, we're nonpartisan, evidence-based, and we're in and for the North. So this paper, as well as many other projects, are possible through the Northern Analyst Collection. And this is a project that allows members to timeshare a professional policy analyst. By merging our collective resources, we can ensure that the smallest municipality or local charities can access high-end skills at an affordable price. Okay, so my presentation will be broken into three sections. The first section is I'll give a brief introduction and as to why we commissioned the piece. Secondly, I'll provide evidence of a crisis, and this will include 5 indicators: 1 for homelessness, 2 for addiction, and 2 for mental health. In the third section, I'll get to the service gaps and the policy strategies. Okay. There we go. Okay, so why did we commission this piece? This piece was commissioned between NOMA, FONOM, and NOSDA. And when I asked why they wanted to commission this piece, the response was because of how deeply affected the municipalities they represent by homelessness, addiction, and mental health. There are many signs of addiction, signs of a crisis in communities throughout Northern Ontario, and municipal governments, as the ones on the ground, face extraordinary pressure from their tax bases to solve these issues. This is illustrated really well in the image of a homeless encampment right outside North Bay City Hall. Although we can speculate of a homelessness, addiction, and mental health crisis, policy change, of course, requires evidence. Oh, sorry, I need to go back. There we go. Okay, so evidence of a crisis. The next 5 slides are going to show evidence that there is, in fact, a homelessness, addiction, and mental health crisis occurring in Northern Ontario. Before I get there, I just want to draw your attention to the crosses for change you can see in the background. This is a memorial site located in downtown Sudbury, and each of those white crosses represent a victim of the opioid overdose. To date, there are over 214 crosses. So getting into the data, and please bear with me while the next few slides I talk about the numbers and the graphs that support the crisis that is happening in Northern Ontario. So to analyze homelessness in Northern Ontario, I analyzed 2021 homeless enumeration data. As you can see on the graph, or to help you understand the graph, the Southern Ontario municipalities are represented in yellow, and the Northern Ontario municipalities are represented in blue. As you can see, the top 4 municipalities with the highest homeless population are all located in Northern Ontario, those being Cochrane, Nipissing, Kenora, and Sault Ste. Marie. Expanding that wider, we can see that 9 out of the 11 municipalities with the highest homeless population are also located in Northern Ontario. Moving along to analyzing the addiction indicators. So I used 2 indicators to analyze addiction in Northern Ontario. The first is the annual opioid-related emergency department visits, and this data was analyzed over a 5-year span. As you can see with the blue bar, there have been opioid-related emergency department visits have increased dramatically over the last 5 years. The second indicator is annual opioid-related deaths by public health unit. As you can see again with the blue bar there. There have been dramatic spikes over the last 5 years, but definitely a dramatic spike between the 2019, represented in yellow, and 2020, again represented in blue. These really extreme spikes are strong indicators that current services and programs in Northern Ontario are not meeting the needs of Northern communities. Moving along. To analyze mental health in Northern Ontario, I used 2 indicators. The first one is the percentage of homeless individuals that self-identify as having mental health and addiction issues. This data was derived from the 2021 homeless enumeration data. During the point in time count in which this data is collected, homeless participants are asked if they self-identify as having mental health and addiction issues. As you can see, homeless individuals are disproportionately affected by mental health and addiction issues. In terms of mental health, 9 out of the 11 districts have reports, 9 out of the 11 participants reported that they were struggling with mental health issues. In terms of addiction, we can see very high rates of people reporting with addiction. The highest is in Greater Sudbury at 80%. The second indicator I looked at was the percentage of individuals that perceive their mental health as very good or excellent. This is important to expand on the idea that mental health and addiction are not merely restricted to homeless individuals, but rather the general public. You can see the yellow dotted line represents the Ontario average for individuals that perceive their mental health as very good or excellent. You can also see that in 6 out of the 7 public health units are below that average. So this indicates that Northern Ontarians in general are suffering from poorer mental health than Ontarians in the rest of the province. So thank you for bearing with me while I go through the data and numbers. Now we can get to the importance of the service gaps and policy strategies. Just give me 1 second. Okay. Okay, so the first service gap that was identified in the report is the community housing waitlist. As you can see from the graph, community housing waitlists have been long and stagnated in many communities. In particular in Nipissing, Parry Sound, and Temiskaming and Thunder Bay have all experienced stagnated waitlists over the last 5 years. In other communities such as Cochrane, Greater Sudbury, and Sault Ste. Marie, waitlists seem to have gone down, although they still have long waitlists for community housing. These waitlists can be attributed to the depletion of housing stock that's between 40 and 60 years old and overdue for routine maintenance and repair. In some cases, community housing units are left vacant as DSABs struggle to keep up with the growing backlog of capital repair. Of course, it makes sense that the most time-effective and financially responsible way to address the shortage of community housing is to maintain and repair the existing stock. However, when the province downloaded community housing to municipalities in 2010, this transfer was completed without a corresponding transfer of adequate reserve funds for current and projected future capital repairs. So the policy strategy that can be identified to address the long and stagnated community housing would be to the province to provide long-term funding to address the backlog of capital repair. It is supported in this report that this funding should come from the provincial government because, as I said, the transfer was completed without the corresponding transfer of resources from the province. Ideally, the funding for capital repair should span over 10 years so that DSABs can develop strategic plans for capital repairs, and that this strategic plan can be included in their 10-year housing and homeless plans, and they could provide updates at the 5-year mark. The next service gap that's discussed in the report is the in-migration of people to service hub communities. This implies that people in rural and remote communities migrate to service hub communities to access social services such as education, healthcare, employment services that are not available in their community. And so they feel no option but to leave their community and migrate to service hubs to access these. Of course, this influx of migrants applies pressure to housing stock and social services within that community, such as homeless shelters, and of course, hospitals and other medical services. This is really difficult for service hub communities because themselves are limited in the resources that they have. The case study that I looked at in terms of in-migration is Sioux Lookout, which is also known as the Hub of the North. So Sioux Lookout is home to the Meno-Yawin Health Center and the Out of the Cold Emergency Shelter. Both these both the health center and the emergency shelter serve approximately 30,000 people over a span of 385,000 kilometers, so a really large area. The extended care facility at the health center currently has 20 beds. Now, this is one bed per 15,000 people. So as you can see, it is extremely under-resourced. Similarly, in terms of the Out of the Cold Emergency Shelter, in 2019, it was reported that 768 unique individuals slept at the Out of the Cold shelter. Now, this accounts for 15% of Sioux Lookout's total population. Annually, in 2019, this shelter provided a bed to 5,000 annual night stays. If this, so again, 15% of Sioux Lookout's population, if this was true for Toronto, in terms of 15% of their population, it would mean that 439,000 people stayed at emergency shelter when the actual amount is close to 4,000. So you can see how skewed the numbers are in Sioux Lookout compared to other places in the province. The policy solution to the in-migration and service hubs is to amend the Health Protection and Promotion Act of 1990. They should amend the Health and Protection and Promotion Act to define northern service hubs and allocate additional funding and additional resources so that these service hubs can adequately address the needs of the population size they serve. So the recommendation made in the paper is through a reserve fund or the like. So the third service gap that's identified in this paper is the lack of medical professionals. Issues in mental health. In this report, CMHA identified that 34 northern communities were areas of high physician needs. Now, this is based on very compelling factors such as long-standing challenges in recruiting and retaining physicians, low healthcare provider to population ratios, travel time to reach service providers, and local demands for services. Now, when I wrote this report in December 2021, I also looked into areas of high physician needs, and the number that was reported in 2010, so 34, had increased to 163 areas in Northern Ontario. So that basically encompasses all of Northern Ontario are in demand, are in high demand for physician needs. Similarly, the Northern Ontario School of Medicine, who also conducts some research on human resources needed in Northern Ontario, identified that 325 physicians are in demand. Of course, this need for physicians acts as a major barrier to the establishment of necessary addiction and mental health services. And unfortunately, many patients are sent to treatment facilities in Thunder Bay, Winnipeg, or Southern Ontario, and this really removes them from their from their support networks, and sets them up to fail. So the case study I looked at here was the Joint Action Health Workforce Planning and Forecasting. So this was born out of a concern from all member states within the EU about the sustainability and robustness of their healthcare system. And they really identified very similar challenges to that of Northern Ontario. And those challenges were demographic shifts, increased demand for services, and aging workforce, recruitment and retention of healthcare workers. So those are all challenges that have been identified in Northern Ontario, which makes this case study very comparable. So the EU, like I said, established the Joint Action Health Workforce Planning and Forecasting. And the main goals of this joint task force is to collect intelligence and data. So they're doing things like monitoring, current and timely data, identifying mobility trends, estimating future skills and competencies that health workers will need, health workforce planning and forecasting and the like. So really it's to inform strategic planning and decision making to address these challenges. And the program has had 3 really great successes. So it's enabled 2 pilot programs, one in Italy and one in Portugal. And then it also enabled a feasibility study in Germany. So, and like I said, this is a 3-year project. So it's great success in establishing already 2 pilot programs.
Oh, sorry.
Okay, so the policy solution to this service gap would be establish a similar task force in Northern Ontario. And this has been already supported by the Federation of Nurses Union, who have called on the federal government to lead such a task force, particularly to investigate new staffing models and other pilot projects to address underlying and systematic retention issues. And as well, we can support programs that are already looking into this, such as the Physician Workforce Strategy from the Northern Ontario School of Medicine. And the Physician Workforce Strategy has the goal of linking human health resources to Northern Ontario's needs. So there's kind of two options there: to establish a similar task force, and also to support ongoing and current research and data collection into physician retention and systematic retention issues. Okay, moving along. The fourth service gap that was identified was housing first. And so Housing First really is a multidisciplinary homelessness strategy that prioritizes the rapid placement of the most vulnerable individuals and families into housing with no preconditions. So that means, they're not expected to be clean from drugs or alcohol. It's really the first step is just to get them into the home, and then support is given to them to address other challenges they're facing. So this model gained popularity in the 1990s, and it is now described as a best practice in Canada, throughout Canada, as you'll see when we get into this case studies, but also in the US. Utah is using many housing first models within the city and internationally as well. So very interestingly, in 2008, the federal government committed $110 million for the most extensive study at that time on Housing First programs. So you can see that the federal government does recognize it as sort of a best practice for solving homelessness and addiction. And this case study, called Cross Sites at Home Chez Soi, took place in 5 cities across Canada. So they were Vancouver, Winnipeg, Toronto, Montreal, and Moncton. Interestingly, these cities were chosen based on the subpopulations that could be studied, such as individuals struggling with substance abuse in Vancouver, urban Indigenous population in Winnipeg, a rural population in Moncton, and so on. And the study found overall that 80% of the 1,000 randomized participants remained housed after 1 year. So that's a great success in itself, 80%. So yeah, that's fantastic. And then the second case study I looked at was from Housing First in Canada. And this studied 8 Housing First programs across Canada in Vancouver, Hamilton, Lethbridge, Victoria, Fredericton, Edmonton, and 2 in Calgary. And this was conducted by the Canadian Homelessness Research Network, the Homelessness Hub, and the Government of Canada. And this study kind of looked at the results of each program over the length of its existence. So, some were 12 months, some were 18 months, and so on. But overall, the study found very similar findings to that of the At Home Chez Soi project. And some of the results were, for example, in Hamilton, 74% of participants remained housed after 6 months, and 90% of this group remained housed after 12. In Lethbridge, the study revealed that 90% of participants remained housed after a 12-month period. And similarly in Victoria, 73% of participants remained housed within a 2-year period, and so on. So all the programs saw tremendous success in participants remaining housed. So the policy strategy here really is to prioritize and support housing first programs. So this aligns with commitments that are already been made by the federal government. For example, in 2020, $1 billion was committed for 3,000 affordable housing units. And in the 2021 budget, a second commitment of $1.5 billion was made by the federal government for a minimum to support a minimum of 4,500 affordable housing units. It also aligns with the Rapid Housing Initiative, and that is funding for housing first projects. So for example, in Severn First Nations in Northern Ontario, they received $21 million collectively to build 85 new homes, again prioritizing rapid housing with no precondition. So these are great steps in prioritizing and supporting housing first programs. There's also a new program that was established by Cochrane DSAB in 2020 called Housing Now, in partnership with the Canadian Mental Health. And again, government support needs to go to programs like this that support housing first. Okay. So number 5, the fifth service gap that's identified is culturally sensitive community housing for Indigenous people. As you can see in the graph, Indigenous people account for an overwhelming amount of the homeless population. You can see in the top 5 there, 5 out of 11 municipalities where Indigenous people represent over 60% of the homeless population. To address the Indigenous homeless population in Sioux Lookout, there was a supportive housing complex that was established through a community-led organizations, which is just fantastic. So this project was a collaboration between Kenora District Services Board, Ontario Aboriginal Housing Services, Northwest Local Health Integration Network, the Menoyawin Health Center, and the Friendship Center. So they opened a 20-unit community housing facility in Sioux Lookout. And this housing facility has reduced 911 calls to the OPP in Sioux Lookout by 90%. So extremely successful community-led project. And from this project, a similar project has been started in the city of Kenora, community-led and in collaboration with different organizations. So that will be a 30-unit facility. And as well, the District of Sault Ste. Marie Social Services Board and the OAHS is discussing another 30-unit facility in Sault Ste. Marie. So that's just fantastic. So the policy strategy here would be to prioritize and support culturally sensitive community housing through the expansion of similar facilities to that of Sioux Lookout and this in the city of Kenora. Throughout Northern Ontario. And these projects can be community-led and then supported by government, which is a really easy win for government to support existing facilities and the expansion. And I just want to note too that the community housing facilities that I'm talking about in Sault Lookout and Kenora, and of course the one that is being discussed in Sault Ste. Marie, these facilities offer culturally sensitive and easily accessible programs and services for Indigenous people. So supporting them with housing and then supporting them with programs and services around their culture. So I think that's where we can attribute a lot of the success. The sixth service gap that was identified is for the Northern Center of Excellence for Addiction and Mental Health. So this, in the roadmap to wellness, the provincial government announced a new action plan, and this was to establish the Mental Health and Addiction Center of Excellence to address mental health and addiction in Ontario with a more coordinated and centralized approach. And so really the Mental Health and Addiction Center of Excellence will strive to standardize and monitor service delivery. And while it's great news that the provincial government is prioritizing mental health and addiction, this isn't necessarily great news for Northern Ontario. In terms of Northern Ontario facing unique service delivery challenges compared to the rest of Ontario. So I think anytime we see standardized and centralized services for Ontario, we have to be cautious of what that means for Northern Ontario. And so the establishment of new services, they must look different in Northern Ontario for them to be effective. And so based on this, there was an engagement process conducted by the Centre for Rural and Northern Health Research and the Thunder Bay Drug Strategy to gauge support of a Northern Centre of Excellence for Addiction and Mental Health. And you can see there on the the infographic some really interesting statistics that came out of this engagement process. So it involved 216 participants from 6 engagement areas. So those were social services, education, peer groups, healthcare policy and justice. And it also included 65 Indigenous organizations. And out of all participants, 95% supported the establishment of a Northern Center of Excellence. So there is robust support in the North for a Northern Center of Excellence. So the policy strategy here would be to establish a Northern Center of Excellence for Addiction and Mental Health, but also a really great win here would be that the provincial government, because this the Center of Excellence is in the development phase, there's opportunity for the provincial government to begin a consultation process and reassess the benefits of establishing a Northern Center of Excellence. Okay, moving along. The 7th service gap that was identified was interfacility transfer. This has been a long-standing problem in Northern Ontario. And so first responders, in particular paramedics, have been overwhelmed with opioid overdose calls. For example, in Superior North Emergency Medical Services answered 187 opioid overdose calls, which is the highest they've ever reported. More generally, in the District of Cochrane, they answered 269 emergency medical calls, and is projected to surpass the previous year's record. So paramedics have a huge workload right now, and their workload is being exacerbated by non-urgent transfers of low acute patients between health facilities. So their workload is being is being exacerbated by patients that are transferring between facilities in Northern Ontario. And this is a really costly expense for municipalities, and it's avoided in other areas of the province by private and nonprofit operators that are contracted by the province. So the policy strategy here would be for the provincial government to provide and fund a third-party operator, like I said, private or public. And in situations where a third-party operator is not available to answer interfacility transfers, municipal paramedics could be used in that situation, but the cost should be reimbursed from the provincial government to municipalities. Okay, last but not least, the 8th service gap that was identified were mobile crisis intervention teams. And this is gaining popularity across the country. So police are answering an increasing number of service calls for individuals experiencing mental health crisis, and they're ill-equipped to handle these calls. In terms of training for mental health patients. And so what happens is it results in a revolving door phenomenon in which police have frequent contact with the same individuals who are often unable to access long-term appropriate care. And so this really drains police resources in terms of the cost of answering these calls and the time that the police are with these individuals because they are required to remain in the emergency department with individuals apprehended under the Mental Health Act until they've been seen by a physician. So this could be, hours depending on how busy the ED is at that moment. So the MCIT model pairs a mental health professional with a police officer. And this is, like I said, had tremendous evidence-based success across many cities in Ontario and Canada in terms of relieving pressure on police officers, providing better support and resources to people who are in crisis, and providing economic savings. So the case study I looked at here was COAST, which is the South Simcoe Crisis Outreach and Support Team. And this was conducted by South Simcoe Police Services in partnership with CMHA and York Support Service Networks. And so they found that they had fewer apprehensions and for people in crisis, and significantly more resources provided to people in crisis. And just to give that a numerical value, they found that for patrol officers responding to mental health crisis calls, the savings was $47.43 per call. So quite a significant savings there. I also looked at the Thunder Bay Joint Mobile Crisis Team, which is a pilot project that was started in 2018. And this is through the Thunder Bay Police Services, Thunder Bay Regional Health Science Center, and CMHAC. And again, tremendous success here in terms of diverting 661 people from ED and 131 people from police custody. So fantastic results here. So the policy recommendation here would be to establish consistent MCIT programs across Northern Ontario. And this is a recommendation that is also supported by the Ontario Big City Mayors in a report that they published in 2019. And, in their words, it has been tried and tested across Canada with tremendous success. And the provincial government has kind of jumped on this bandwagon in recent recent years through establishing 4 new pilot programs in Ontario, with 1 on Manitoulin Island. So it would be so, you know, we could use more for sure in Northern Ontario. So that sort of concludes the report. I just included this slide. You know, what I found was, you know, all levels of government have a role to play. Fantastic community-led programs in terms of Housing First, mobile crisis units, and these could be easily supported by higher levels of government to create easy wins across Northern Ontario. So thanks so much for listening. Does anyone have any questions? And I will stop sharing my screen here. There we go.
I have a question.
Mm-hmm.
So again, I've said earlier that I'm in cont'd, so I'm just outside of Thunder Bay. I know, like, we don't have a city center. We don't really have any commercial. We're kind of just half an hour from the city. So, but I know that in our case, we've had an increase in things like overdoses. We have had people, like transient population, come through in the summer, camping out places. So we've seen some of the challenges arise from the opioid crisis.
Mm-hmm.
I'm kind of wondering what kind of, I know the major city centers have, you know, been wanting to work on this problem and like kind of solve, like come up with solutions. But what about with the smaller rural municipalities like mine, you know, and our surrounding neighbors? Because we have like 6 rural organized or whatever incorporated municipalities outside of Thunder Bay, and then there's the unincorporated region all around there. So what about the strategies that rural areas can use to work together to help solve this problem? Because like we have it in our community, it's everywhere. What are things that we can do to work together, not only with the rural areas, but with the major city centers? I just sometimes find that there's like a bit of headbutting and like, you know, well, who's got it worse? But like we're all in this together. This is our region. Like we all live here. So what can we do to help, you know, advocate to the government to like subsidize these programs? I really like your presentation. So, but I'm just kind of thinking like, how can I apply it to my community my surrounding communities to really like, you know, boost this effort?
Yeah, so it's definitely a challenge for smaller communities because homeless populations and, like you said, opioid crisis, of course, touch all of those communities. However, you know, resources are limited in that sense. So I think it's really, you know, collaboration in terms of service hub communities. It would be, you know, adding extra resources and you know, potentially shared resources between rural communities and service hub communities to ensure that everyone can be served. But it's definitely, I understand what you're saying, it's definitely a challenge.
Are there any other questions?
Sure, Mac. I probably would have about 15 or 20 for Holly, but
Mark, you're on mute. No, you're not.
Thanks, Mac. Tremendous report, Holly. Actually, well done. I think it opened a number of people's eyes about the disparity actually that we're seeing in Northern Ontario in relationship to Southern Ontario. And certainly that fact surrounding Sault Ste. Marie, Kenora, Nipissing, and Cochrane having higher homeless numbers than the 5 largest municipalities in Ontario was a tremendous thing. But and there's so many problems. They're highly difficult to deal with. But you had 8 strategies here, and I'm interested in number 7 with respect to the contract of third-party operators with EMS, and you mentioned other methods that are used, I guess, in Southern Ontario. Do you know how those are how those are funded, as Nipissing is going through rationalization of our EMS right now, but I'm interested in hearing how they're funded, how they're operated, and whether or not something that we could use here in the district of Nipissing.
Mm-hmm. Yeah, so they're funded through the province. In other areas of the province in Southern Ontario, the provincial government contracts third-party operators, contracts and funds third-party operators for interfacility transfer. So yeah, through the province.
Okay, thanks, Mac, and thanks, Holly. Great information. Thank you.
So Holly, a question in the chat is, has the pilot project in the Manitoulin Island that you spoke of begun?
Yeah, so that's that pilot started, let me just think here, I believe in the last year, and so I think they're still in the development phase, but you know, it will be in practice very soon, I believe. So very exciting times for Manitoulin Island.
I have a question regarding that pilot project. I believe there's none of them, like we already have that in North Bay, but it's not provincial funding, it's done through the police board. Is that correct? Like all the sites, it sounds good, but it's only the municipalities that are operated by OPP or serviced by OPP, not municipally run police departments.
And that's definitely, I think, where the opportunity to look at these that are run by the OPP and expand them to the smaller communities. You know, of course, you know, all communities have a police force that they could collaborate with. It's just a matter of finding the resources to collaborate with the smaller municipalities and with mental health professionals. So I think there's definitely an opportunity to expand it beyond OPP, beyond OPP resources.
Yeah, well, what I'm saying is that North Bay has been doing it, but we don't get provincial funding for it.
Exactly. And so
there again, disparity,
and so
difference.
Yeah, exactly. And so that's, you know, that's the point that I'm getting to here, is that those community-led especially the existing pilot programs, like you say in North Bay, those they should be supported by the provincial government, not necessarily through you know, the OPP, the provincial police force, but through other means they should be supported.
So to that point, Joanne, it would be interesting to find out, and I'll try to find out, is that if because of the formula for community policing under the OPP contract, if this is an additional service, if those municipalities would be paying for it, because you pay for what you get with the OPP. It is a provincial police force, but the fact is just if they came in and took over North Bay, you and I'd still be paying for it as councillors for the city of North Bay. You know, we'd be paying for the level of care that they are providing in our community. So I'm sure that even though the OPP is doing it, not a municipal force, that there is going to be a cost associated to it.
Yeah. Okay. My other question, and I don't want to, I know nothing, I'm not on the DSAB board. I know Mark and Mac are, and probably others on this call, but when you looked at those 11 municipalities and 9 of them are DSAB formats and 2 aren't, are the DSAB format municipalities or region less funded than other municipalities down south? When you go per capita, or when you go, has a study ever been to compare that? Or
can I just clarify, are you talking about the homeless enumeration data, or?
Yeah, just because, is it because we're lacking funding that we have an issue in the north compared to the south? Or is it the structure of the delivery of the services, or?
I would argue a little bit of both.
Yeah.
Certainly service delivery in Northern Ontario is challenging because of the large geographical region and the low population density. So there definitely are challenges in Northern Ontario, not in terms of not in terms of like the point in time counts that are conducted though. They are definitely challenged by low population density as well. And actually before this year, they could municipalities in Northern Ontario could choose between point in time counts or a period prevalence count. And because of the characteristics of municipalities in Northern Ontario, many municipalities chose to do a period prevalence count, which was conducted over a week. Now, the government found that this count would find on average 8 to 10% more homeless people than using a point in time count. Which is the reason I would have loved to be able to show growth from 2018 to 2020, but unfortunately that data is not comparable. Now in 2021, this was standardized across all municipalities of Southern Ontario. So the only option now for municipalities is to use a point in time count and not a period prevalent count. So the good news is that in 2 years time, in 2022, well, even less than, it will be comparable data, and we can compare between 2022 and 2018 and so on and so forth. Yeah, the point, yeah, it does kind of skew the numbers a little bit, but going forward, it'll all be comparable.
If I could just kind of help out a little bit, Holly, Mark King here, and just for Joanne's benefit, the federal rapid housing envelope that basically was scooped up by all the larger cities in Ontario. The only recipient actually in Northern Ontario was the city of Sudbury. The balance of Northwestern and Northeastern Ontario, they were shut out of that particular money. But when you look at the disparity that we're facing here in the housing sector, it's absolutely huge, and you can see why it's happening. And your study really provides that great information to recognize how skewed it is. It's actually quite sad to watch it, but. Anyways, thanks, Holly. I hope that helps a little bit.
Thank you.
So any other questions of Holly?
Yeah, I was just going to ask quickly, in March, I'm organizing a presentation on the opioid crisis for my community, for my council and staff. Would I be able to use some of your presentation in that? And could I contact
you? Of course.
You?
Yeah, of course. Would you mind putting maybe your email in the chat here, and I'll connect with you outside of this later on.
Perfect, thank you.
No worries.
Okay. And Leslie, if you want to, my email was in the earlier, so we're just, I'll leave the meeting up for about 15 minutes after we're done, just so that you guys can communicate back and forth inside the chat function. Any further questions of Holly or Mark? No, just kidding. I wish to thank not only Holly, but also Todd, Ian, and Mark for their presentations today, and thank all of you for participating. I'll remind everyone that if they would like a copy of any of the presentations, they can just email FONOM, as the presenters were gracious enough to forward them to me, so I have copies that I can email to you. Also too is that the last two sessions, so Mark and Holly's presentation, were recorded, and they will be posted to the FONOM YouTube channel by tomorrow morning, hopefully tonight, but by tomorrow morning they'll be available so that you can share them. and use them as resources for your purposes inside your municipality. Again, I'd encourage everyone to consider registering for the FONOM conference in May, which is going to be hosted by the City of North Bay, so by Mark and Joanne and their colleagues on council. And we promise that it won't be minus temperatures every single day that you're in North Bay in May, but we're not going to promise that it's not going to be cold at least one of those days. But again, we do have some exciting things planned around the new casino that's going to be opened, tours of the ONTC bus line, the leaders debate with the 4 provincial leaders, because the conference is in the middle of the campaign period. And then also too is other sessions that will be of importance for your municipalities. So again, thank you very much for your participation today.